my name is Dr. Naveen Rajagopalan. I'm a heart failure cardiologist at the University of Kentucky. I'm also the director of the Gill Affiliate Network. Heart failure is unfortunately a very common diagnosis. It is becoming more and more common in the United States and across the world, primarily as the population ages, and also as we're seeing more and more risk factors for heart failure. Those include diabetes, hypertension. Unfortunately, there are some subset of heart failure patients that are not responding well to medical therapy, and therefore a physician may want them to be referred to a heart failure specialist. So these are cardiologists that have received specialized training in advanced heart failure. So many times a cardiologist will say, look, you may be doing well, but maybe you should see a specialist just to see if he or she is aware of any new treatments that are out there. So we do serve as a resource for cardiologists that sometimes maybe just want an extra set of eyes on their patients. When patients aren't doing well, a doctor may send them to me and say this patient needs a heart transplant. And sometimes that is the case, and we have to proceed with working that patient up for a transplant. But other times we're able to determine the patient can be a candidate for another medication or another intervention, and they get better and they don't need a transplant, which is obviously a better for everybody. Since July 2024, I've been coming once a month to the heart failure clinic at King's Daughter, and so far it is working out very well. King's Daughter has a very well-established heart failure clinic, but when I was meeting with them last year, a lot of the providers there said that yes, there are some patients that they're worried about. Maybe they're starting to get worse, maybe they're not responding to medical therapy. Historically, I've seen some of these patients in Lexington, but that's a long drive, and sometimes the patient may say, look, do I have to travel 2 hours just for the doctor to say, look, let's just adjust your medication? And so it's really been rewarding. The idea is that by coming to Ashland, I'll be able to provide that expertise closer to home. We've been able to identify patients that we needed to, adjust their medications to try to improve their symptoms. A couple of the patients I've seen, I think relatively soon may need to be looked at in Lexington for options like a heart transplant or an LVAD. But certainly, my hope is for all these patients that we don't have to do that we can get them better. I try to counsel patients to tell them that heart failure can recover, that it can be controlled with medications, and that many patients can lead a normal quality of life. I certainly have met many patients where, they were sent to me thinking they needed a transplant, and then 10 years later, they've not been hospitalized once. And so that's very rewarding to see. And it has been quite gratifying over the last several years to see the closer relationship between the University of Kentucky and King's Daughter Medical Center. King's Daughter has a great reputation in cardiovascular medicine. There are many cardiologists here that have had close relationships with over the years, and I'm really excited about the closer synergy between the two health systems. So heart failure is a quite common illness, and the team here at King's Daughter is very capable to take care of those patients. And certainly, I hope that over the next several years, we see closer collaboration between the team at King's Daughter and UK and various other aspects of medicine. And so King's Daughter recently became a member of the Gill Affiliate Network. And certainly, I think by leveraging the expertise at both institutions, we can really make an impact on the health of residents of Ashland.